The ketogenic diet is a low-carb, high-fat diet that is arguably one of the most popular diets when it comes to weight loss. Despite the current hype around it, the keto diet actually has been around since the 1920s as a treatment for epilepsy. Now it's seen as a remedy for infertility, weight loss, and type 2 diabetes. And while it does have its benefits for some individuals, especially when it comes to weight loss, which you'll hear many swear by as most people post their results all over social media, this video will look at 5 reasons you want to avoid keto. If you guys are new here, this channel is all about helping you make informed decisions as well as be in the know when it comes to your health and wellness, and I would love for you all to gently tap on the like button down below. If you really like the content, then consider subscribing. Also, if you guys are on Instagram, you can follow me there too. Now, without wasting any more time, let's get straight into it. Now, the first reason why you should reconsider the keto diet is because of kidney stones. That's because a high intake of animal foods can cause your blood and urine to become more acidic, leading to increased excretion of calcium in your urine. In the systematic review and a meta-analysis, a total of 36 studies with 2,795 patients, 5.6% of the patients developed kidney stones with the ketogenic diet after 4 years. They're mostly uric acid stones followed by calcium-based stones and uric acid calcium mixed stones. This was mostly related to the hypocytraturia and acidosis, which is going to be a common problem with the keto diet. The acidosis contributes to significant reabsorption of citrate in the proximal tubule, further contributing to hypocytraturia. And also, keto diets in the general sense may cause low urine potassium due to strict limitations of fruits and vegetables, which we know low levels of potassium levels contribute to kidney stones. Second reason as to why you want to avoid the keto diet is hypoglycemia, which is a dangerous drop in blood sugar. But isn't lowering carbs and lowering blood sugar a good thing? Yes, to an extent. While the keto diet has been seen to be beneficial in lowering A1C, which is a measurement of your average blood sugar levels over the past 3 months, people with type 1 diabetes may be at a higher risk of hypoglycemia, causing confusion, shakiness, and sweating. This study actually looked at just that. They found while it did decrease HbA1c, it was a trade-off for dyslipidemia, which is your cholesterol imbalance and a high number of hypoglycemic episodes. This can be the case as well if you're type 2 diabetic as well and you're taking insulin, so do be aware of that. The third reason to reconsider the keto diet is cholesterol imbalance, and the studies on this are a little mixed though. Some show us that the diet does in fact have the potential to exacerbate or cause hypercholesterolemia in patients with or without underlying genetic hyperlipidemia, while others show us that it can decrease the level of triglycerides, LDL cholesterol, and blood glucose and increase the levels of HDL cholesterol. The problem is that there is no limit on saturated fats, and we all know that not all fat is the same. Bacon fat is much different than almond fat, which is why if you have trouble managing your cholesterol, I would err on the side of caution, especially if you already have kidney disease, liver diseases, familial hypercholesterolemia, or what is known as fat-induced lipemia, because the diet may actually worsen these conditions. The fourth reason is bowel irregularities, and you might have experienced this actually before if you've tried it yourself. The truth is, some people have difficulty digesting large amounts of dietary fat. This leads to really greasy diarrhea. Many of the richest sources of fiber like beans, fruits, and whole grains are restricted when you're on keto, and you need them to bulk up the stool, but the reverse can also happen. You can be too bulked up as well and have constipation, especially in the early days when you're still on the keto flu. My tip here would just be to increase the fiber, like get more chia seeds, almonds, and coconut, since they are also keto friendly. These may not seem to be a big deal to a lot of people though, but if the condition persists, dehydration and loss of electrolytes are a real consequence if these symptoms get ignored, which oftentimes does happen, especially in the beginning. The dehydration part especially, because your total body water is already decreased as carbohydrates become depleted on a keto diet. And as you all know, for every 1 gram of carbohydrate stored as glycogen, there's approximately 2 to 3 grams of water retained with it. And lastly, the fifth reason, it takes the fun out of eating. It really does. Now, you might be thinking, well, so what? It's only temporarily, no pain, no gain. Here's why that's a big problem. In the beginning, if it all goes as planned, you will experience rapid, significant weight loss. 10 pounds a month, 14 pounds a month. Those are all possible, but you need to be honest with yourself. Do you find that the diet is too restrictive? Because for me personally, I did, which is why I decided not to do the keto, because you want to be careful not to open the door for weight regain episodes and the perpetual cycle of yo-yo dieting, which we know causes belly fat and increases diabetes risk. This study showed us that a 2 to 6% body weight regain can already reverse the benefits of losing 10% or more body weight. Because essentially, the more times you yo-yo, the theory goes, the more fat your body gains in each rebound. So it's important to have a strict approach to this type of dieting if you choose to go this route. Or better yet, find a diet you can actually stick with and have fun with. A diet that can be personalized to fit your lifestyle and not one that is just pushed by your favorite influencer or celebrity. I'm more curious to actually hear from you guys though. Have you tried keto? What are your thoughts? Let me know in the comments below, and also hit that subscribe button too if you found any value, and I'll see you on the next one.